was in class recently and I was introduced to a phrase I had never heard: the political determinants of health. Were you aware? Well, let's dig a little deeper, shall we? By now, we should have all heard about the social determinants of health. If you need a quick refresher, check out this video. I'll also post a link below. As I mentioned, I was in class and my professor began speaking on the political determinants of health. Thus began my research. This term was coined by the World Health Organization several years ago, and then it abruptly disappeared. And you probably can guess why. It was political. But before I go any further, let me say, hey there and welcome. If you are new here, you probably don't know me yet. I am Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. Help us continue to spread the word to others. Well, the political determinants of health phrase is making a comeback, and let me introduce you to it. In a 2020 book by Daniel E. Dawes Jr., who's the director of the Satcher Health Leadership Institute at the Morehouse School of Medicine, the political determinants of health look at the forces that have led to the social determinants of health. In an article featured in the Patient Engagement HIT titled, "What are political determinants of health and do they differ from the social determinant of health?" If social determinants of health are the social factors that affect our health, then political determinants of health are the policy choices that led to those social determinants of health in the first place. Here's a quote: "The political determinants of health involve the systematic process of setting up relationships, distributing resources, and distributing power, all at the same time, in ways that reinforce or affect each other to create opportunities that either improve health equity or make health inequalities worse." End quote. And that was what Dawes wrote in the book. In a field that often talks about upstream and downstream factors of health, political determinants of health can explain how someone ended up in a certain part of that stream. So in a sense, these are the political determinants of health, Dawes said at the American Medical Association Roundtable in 2020. Somewhere upstream decisions were made to change the course of the river to help some people and hurt others, and then to put some kinds of people on one side of the river and others on the other side. Take the safety and quality of housing as an example. Having a safe and clean place to live is a social determinant of health. The practice of redlining, which put Black and brown people in more disenfranchised neighborhoods, is a political determinant of health. There are three types of political factors that affect health: voting, government, and policy. For example, voters choose who gets to be a policymaker, which gives those people the power to change policy. In turn, these policies can affect how well people are doing in general. This policy could have direct effects on healthcare, like the Affordable Care Act or the creation of Medicare. Or it could have indirect effects on health through social factors that affect health. For example, laws that give money to fix up public transportation can have an effect on health, believe it or not. If most of the money for the public transportation goes to wealthy areas, it could make health disparities worse by making it harder for people to get to health care. During this election season, it's important to keep in mind that solving political problems may depend a lot on how people vote, and then hold policymakers accountable. The article also speaks directly to the clinicians and the advocacy role they can play. There's that word again, advocacy. You know, it's my friend. Dawes said that healthcare workers can do something about the political factors that affect health in the exam room by being culturally sensitive and getting rid of their implicit biases. Quote, and I do think it's important for people to know that when they work in certain communities, they shouldn't make the same judgments about the people who live there that we and others have made all along, end quote. That was from Mr. Dawes as well. A clinician can't change a political factor that affects a patient's health unless that clinician is also in charge of making policy. But what they can do is they can take into account the political factors that affect a patient's lifestyle or situation. By doing this, the doctor or nurse can stop judging the person and work to improve the health equity. Again, in the book, Dawes said that clinicians can also speak up for their patients. Even though clinicians don't write health policy on their own, they can be advocates while they help make health policy. So you have learned there is such a thing as political determinants of health. I think we both learned that. You have also learned that the political determinants of health are made up of 3 categories. And lastly, you have learned how you, as a healthcare professional, can support the political determinants of health. Questions of the day. Were you aware of this term? Was it new to you like it was for me? Does this information make sense for you and give you some food for thought? My final thoughts. First and foremost, your vote matters. Understanding how all things are connected that impact you and your families is essential to understanding why it is so important that you exercise your right to vote. For some, it is hard to realize that your vote is so powerful and can affect policy changes that can have an impact on your community's health. Also, advocacy matters. If you have followed me and heard me talk at any time, you know I am all about the power of your voice and advocating for what you believe in. Here's another example where that rings true. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out.
Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you. So let me know you were here by providing a comment or question. You can also just stop by to say hi, but you can also give me a little love by sharing this video on your social media platforms. And you can do so by tagging me in your video share at prncodingedu so I can see it. Let's stay connected and connect others. Well, you have stayed until the end. Let me know in the comments you were here by using the hashtag political determinants of health. And let me know if you have specific questions or items you would like to see discussed here on our channel. If you want to learn more about the wonderful world of health information, medical coding, and/or compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thanks so much for watching.